Imagine waking up strapped to a table, your head shaved, and a surgeon calmly preparing to cut through your skull because he thinks it will cure your sadness. In medieval Europe, this wasn't madness. It was medicine. Trepanation, the surgical removal of bone from the skull, was a recognized medical procedure throughout medieval Europe from the 12th through 15th centuries. Medieval medical texts, including those by Guy de Chauliac and John of Ardern, provided detailed instructions for the procedure. These physicians operated under the dominant medical theory of the four humors: blood, phlegm, yellow bile, and black bile, believing that imbalances of these substances within the skull caused headaches, epilepsy, and mental disorders. The procedure was not relegated to quack healers or rural folk medicine. It was taught in prestigious medical schools like Salerno and practiced in monastery hospitals across Europe. Archaeological evidence from medieval burial sites reveals that 2 to 5% of skulls show evidence of trepanation, indicating thousands of procedures were performed during this period. Medieval physicians inherited their understanding of trepanation from ancient Greek and Roman sources, particularly the works of Hippocrates and Galen. They believed the skull could become overpressurized with corrupt humors, causing intense pain and mental disturbance. When these substances putrefied inside the head, they created toxic vapors that pressed against the brain tissue. The Hippocratic text on head wounds explicitly recommended trepanation for certain head injuries, and medieval physicians expanded these indications to include chronic headaches, epilepsy, and what they term melancholia and mania. The medical treatise Curative Magna by Guy de Chauliac, written in 1363, describes trepanation as essential for treating apostemes of the brain, collections of corrupt matter that could only be drained through surgical opening of the skull. Medieval medical theory held that the brain itself was insensible to pain, making the procedure theoretically less traumatic than it appeared. Physicians observed that patients with depressed skull fractures sometimes recovered after bone fragments were removed, not understanding that this was due to reduced intracranial pressure rather than the release of humors. This theoretical framework meant that trepanation was prescribed for a wide range of conditions that modern medicine recognizes as neurological or psychiatric disorders. The primary instrument for medieval trepanation was the trepan itself, a circular saw blade mounted on a T-shaped handle that surgeons rotated by hand. Archaeological finds from medical sites show these instruments were typically made of iron, with teeth around the circular cutting edge. The trepan came in various sizes, from small instruments creating holes less than an inch in diameter to larger versions capable of removing substantial sections of skull. Medieval surgical manuscripts describe additional tools used in the procedure: elevators for lifting bone fragments, sequestrum forceps for removing dead bone, and curved needles for suturing the scalp afterward. The Chirurgia of Roger Frugard, dating to around 1170, provides detailed illustrations of these instruments alongside step-by-step instructions for their use. Wealthier patients might have procedures performed with higher quality instruments, including bronze or silver inlaid trepans that were easier to keep sharp and clean. However, the fundamental mechanics remain the same regardless of the instrument's quality: a slow manual cutting process through living bone while the patient remained conscious. Medieval surgeons had no effective anesthesia beyond wine, opium preparations when available, and herbal compounds like mandrake. Most procedures were performed with the patient fully conscious, held down by assistants while the surgeon worked. The cutting process itself was deliberately slow to prevent bone splintering and overheating. Contemporary medieval medical texts provide explicit instructions for performing trepanation. The surgeon would first examine the patient's skull to locate the optimal site, typically choosing areas where the bone was thickest and furthest from major blood vessels. Guy de Chauliac's Chirurgia Magna recommends avoiding the temporal region due to the risk of arterial damage. The patient was positioned on a table with the head firmly supported. The surgeon would shave the area and make an initial incision through the scalp, peeling back the skin and muscle to expose the bare bone. This created significant bleeding, which medieval texts acknowledge as a major complication requiring careful management. The trepan was then positioned perpendicular to the skull surface. Medieval surgical manuals emphasized the importance of maintaining steady, even pressure, while rotating the instrument to prevent the blade from wandering or breaking. The cutting process typically took 30 minutes to several hours, depending on skull thickness and the surgeon's skill. Medieval physicians knew they had successfully penetrated the skull when brain tissue or cerebrospinal fluid appeared in the opening. They interpreted the appearance of fluid as evidence that corrupt humors were being successfully drained from the skull cavity. The procedure concluded with cleaning the wound and suturing the scalp, often leaving the bone opening permanently uncovered. Post-operative care involved monitoring the patient for signs of fever or infection, though medieval medicine had no effective treatment for these complications when they arose. Modern analysis of medieval skulls provides stark evidence of trepanation's mortality rates. Studies of burial sites across Europe show that approximately 30 to 40% of trepaned skulls display evidence of bone healing, indicating the patient survived long enough for the wound to begin closing. This means that 60 to 70% of trepanation patients die within days or weeks of the procedure. The primary causes of death were infection, hemorrhage, and direct brain damage. Medieval surgeons had no concept of sterile technique, and the exposed brain tissue provided an ideal pathway for bacteria to enter the central nervous system. Many skulls show evidence of chronic infection, with characteristic bone changes indicating months-long battles against sepsis. Archaeological evidence also reveals the complications faced by survivors. Many trepanned skulls display signs of brain herniation, where swollen brain tissue protruded through the skull opening. Others show evidence of secondary fractures around the trepanation site, suggesting that the structural integrity of the skull was compromised by the procedure. Some patients underwent multiple trepanations, as evidenced by skulls displaying several healed openings. This suggests that when the initial procedure failed to provide the expected relief, medieval physicians would attempt additional drilling rather than questioning the underlying theory. The bone evidence provides undeniable proof of the suffering endured by trepanation patients. Archaeological surveys have documented medieval trepanation across virtually all of Europe, from Ireland to the Byzantine Empire. The highest concentrations of trepanned skulls are found in France, England, and northern Italy, regions with well-established medical schools and urban surgical practices. In England, trepanation was commonly performed in monastic infirmaries. The Hospital of St. Bartholomew in London maintained medical records documenting numerous skull surgeries performed between the 12th and 14th centuries. These records show that English practitioners favored smaller trepanation openings, typically less than 2 inches in diameter. French medieval surgery, as documented in the works of Henri de Mondeville and Guy de Chauliac, showed a preference for larger openings and more aggressive bone removal. French surgical texts from the 14th century describe removing entire sections of skull in cases of severe head trauma or suspected brain disease. German and Italian practitioners developed variations in technique, with some favoring multiple small openings rather than single large ones. The surgical school at Salerno, one of Europe's most prestigious medical centers, produced detailed treatises on trepanation that influenced practice throughout the Mediterranean region. The widespread geographic distribution of trepanation demonstrates how thoroughly integrated this procedure had become into mainstream medieval medicine. Medieval trepanation was performed by various categories of medical practitioners, from university-trained physicians to monastery-based surgeons to itinerant specialists. The most skilled practitioners were those who had studied at established medical schools and had access to classical texts on surgery and anatomy. John of Ardagh, a 14th century English surgeon, documented numerous trepanation procedures in his medical writings. His works describe the challenges of the procedure and acknowledge its high mortality rate, while still defending its necessity for certain conditions. Ardenn's surgical manual includes detailed anatomical drawings showing the proper placement of trepanation holes and the underlying brain structures. Guy de Chauliac, considered one of the most accomplished medieval surgeons, performed trepanation as part of his practice in Avignon during the 14th century. His Chirurgia Magna became the standard surgical textbook for centuries and included extensive sections on skull surgery. De Chauliac emphasized the importance of proper patient selection and surgical technique in achieving successful outcomes. Many monastery infirmaries employed monks who had received training in basic surgical procedures, including trepanation. These religious practitioners often combined surgical treatment with prayer and religious ritual, viewing the healing process as both medical and spiritual. The economic incentives surrounding trepanation were substantial, with successful practitioners commanding high fees for their services. The gradual abandonment of trepanation during the late medieval and early Renaissance periods resulted from several converging factors. The translation of Arabic medical texts into Latin introduced European physicians to more sophisticated anatomical knowledge and alternative treatment approaches. Works by Islamic physicians like Al-Razi and Avicenna provided detailed critiques of skull surgery and recommended less invasive treatments for headaches and mental disorders. The rise of university-based medical education promoted more systematic observation and record-keeping, allowing physicians to document the poor outcomes associated with trepanation. As medical schools began requiring more rigorous training in anatomy and pathology, practitioners became increasingly skeptical of the humoral theories that justified skull drilling. The development of alternative treatments also contributed to trepanation's decline. Herbal medicines, bloodletting, and dietary modifications offered less dangerous approaches to treating the same conditions that had previously required skull surgery. While these alternatives were not necessarily more effective, they carried significantly lower mortality rates. By the 16th century, trepanation had largely disappeared from mainstream European medical practice, though it continued to be performed in rural areas by traditional healers for several more generations. Medieval trepanation existed within a complex religious framework that viewed illness as potentially spiritual in origin. While the Catholic Church never officially endorsed skull drilling, many religious authorities accepted it as legitimate medical treatment when performed by properly trained practitioners. Monastery hospitals were among the primary sites where trepanation was performed during the medieval period. Religious practitioners often incorporated prayer and ritual into the surgical process, viewing successful healing as evidence of divine intervention working through medical skill. The medieval understanding of mental illness included both natural and supernatural explanations. While physicians attribute conditions like epilepsy and chronic headaches to humoral imbalances, they also acknowledge the possibility of demonic influence or divine punishment. This dual framework meant that trepanation could be presented as treatment for either medical or spiritual afflictions. Religious medical practitioners documented numerous cases where they attributed successful trepanation outcomes to saintly intercession or divine grace. However, these same records also acknowledge the high failure rates and devastating complications associated with the procedure. The religious context surrounding medieval trepanation demonstrates how medical practice was inseparable from spiritual belief during this period. Analysis of tripping skulls from medieval burial sites reveals that the procedure was performed across social classes, though with significant variations in technique and aftercare quality. Wealthy patients received treatment from skilled university-trained surgeons using high-quality instruments, while poor individuals often underwent the procedure at the hands of less experienced practitioners. Medieval medical records document trepanation being performed on nobles, clergy, merchants, and peasants alike. The primary determining factor was not social status, but the severity of symptoms and the patient's ability to pay for treatment. Chronic headaches, seizures, and behavioral changes were seen as legitimate medical conditions requiring surgical intervention regardless of the patient's background. Women appear to have undergone trepanation at rates similar to men, contrary to some assumptions about gender-based medical discrimination in medieval Europe. Archaeological evidence shows trepanned skulls of both sexes across all age groups, from adolescents to elderly individuals. The decision to undergo trepanation was typically made by family members when a patient's condition became unbearable or socially disruptive. Medieval medical ethics placed primary authority with the family rather than the patient, meaning that many trepanation subjects may not have consented to the procedure. This social context reveals how deeply embedded trepanation had become in medieval approaches to treating severe illness. The practice of medieval trepanation represents one of history's most persistent medical delusions, a procedure that caused immense suffering while providing no therapeutic benefit, yet was performed by educated, well-intentioned practitioners for centuries. The archaeological evidence of thousands of trepanned skulls across Europe provides stark testimony to the power of medical orthodoxy to perpetuate harmful practices. Medieval physicians who performed trepanation were not ignorant barbarians, but respected members of society operating within the best medical knowledge available to them. They had studied classical texts, received formal training, and genuinely believed they were helping their patients. Their tragic error was in trusting theoretical frameworks that bore no relationship to anatomical reality. The suffering documented in medieval bone remains forces us to confront the horrific consequences of medical confidence unsupported by scientific method. Patients who sought relief from unbearable pain instead received procedures that frequently killed them or left them with permanent brain damage. The holes drilled in their skulls remain as permanent evidence of medicine's capacity for systematic harm when guided by incorrect theory rather than empirical observation. Medieval trepanation stands as a warning about the dangers of medical authority exercised without proper scientific foundation, a practice that destroyed thousands of lives while its practitioners remained convinced they were performing acts of healing. The archaeological record preserves their agony for us to witness, a testament to suffering inflicted by the very people trusted to relieve it.